Good morning, everybody, and welcome to the meeting of the Children, Young People and Families Cabinet Panel. I'm County Councillor Teresa Heritage and I'm chairing the meeting today. Just before we start, I have the usual COVID announcement. Due to the coronavirus pandemic, the Council will be holding this meeting electronically in accordance with the relevant regulations. Members of the public may also attend this meeting in an electronic capacity, and there is a link on the Council's website for them to do so. Members of the Council are asked to keep their microphones switched off until called to speak, and to switch their microphones off once they have finished speaking. Cameras may be left on throughout the meeting if members wish, but it's actually less distracting if cameras are kept off to allow the speakers to be sort of seen and heard. If you experience connection or other technical issues, it may help to switch your camera off. Cameras should be switched on if and when speaking at the meeting. To indicate a wish to speak, members should use the raised hand function. Use of the meeting chat function is exclusively for voting. At the end of the debate on each item of business, there will be a vote. Members should be voting using the chat function by indicating for, against or abstain. I will declare the result at the end of each vote. Breaks of at least 15 minutes will be held every 2 hours and will be taken after a speaker in the debate has finished. If we are voting, the vote will be concluded before the break is taken. Other breaks will be incorporated as appropriate. So, members actually attending the meeting today, I'll read that list out. Michael Muir, could I ask you to turn off your camera, please, because you're not actually in attendance at the meeting. Thank you. So, membership changes, there are none. We have a late apology from Lynn Chesterman, who is unwell, so I wish Lynn well. So the members in attendance today are Nigel Bell, Susan Brown, John Greer, Dee Hart, Karen Hastrick, Leslie Greensmythe, myself, Tina Howard, Graham McAndrew, Alan Pancy, Anthony Rowlands and Mark Watkin. Could I remind members to give any declarable interests as we come to an item? So the first item on the agenda is to confirm the minutes of the meeting held on the 2nd of February. If you are in agreement with those minutes, let me put my participants on so I can see if there's any hands. If you are in agreement with those minutes, please could you indicate? Thank you. So we have the majority there. Thanks very much. So next item is public petitions. There are none. And so we're moving on now to the first main part of the agenda, and that's the development of a Hertfordshire poverty programme. And Sally Orr, Head of Family and Health Services Commissioning, Health Services Commission, that's right, it's a mouthful, is giving us a presentation. So over to you, Sally.
Thanks very much, Terry. Thank you. And thank you. Lovely to see everybody. I haven't been in front of this meeting for a while, so it's really nice to be back. I've got a presentation to share with you, which hopefully you can all see on the screen there. And I'm here today to talk about the development, and it's a corporate across the county council programme that children's services have just begun to develop with adult care services and public health, and I wanted to talk you through our early thinking and to get some thoughts on it. There's been a lot in the media, a lot of reports done about the impact of COVID and how this has heightened the number of people, and particularly families, living in low income and living in poverty, and Hertfordshire is no different from this. A lot of negative, as I said, so I thought I'd start off with some positive findings from a recent report from the Youth Sports Trust, which was looking at the impact for children and young people of the restrictions over the past year. And some interesting findings there about more creative learning. I think that's to do with doing more hobbies and things that you could do at home. The interest in the caring professions, we've seen in the University of Hertfordshire, the number of applications for nursing has increased exponentially recently. More family time, I'm glad they've put that down as a positive. I'm not sure all the children would feel like that, but definitely an impact on the environment and climate because of less traffic on the roads. But the same report picked up on some of the issues that we've seen in a number of different reports, and that you have items later on in this meeting to look at. The impact on children and young people's health, mental health and anxiety, increases in domestic abuse, social isolation, loneliness, and children and young people are really concerned about these things, particularly because a number of children and young people are seeing the impact on their own families of losing parents and carers, losing work or being furloughed or losing their businesses. The Rowntree Foundation is always the go-to place on this topic and have some really useful resources. And they define poverty very simply as not having enough resource to meet your minimum needs. But the more sort of technical definition that's generally been in use for some years now, UK Poverty Report, as those with a household income of under 60% of the national median. And there's a lot of data beginning to emerge about how that's impacting us in Hertfordshire, and some sort of headlines here. Though the number of people entitled to universal credit more than tripled in a year from August 19 to August 20, up to 40,000, and particularly impacted children and young people aged 16 to 24 years, and that rose up to 8,500. We've got over 9,000 children and young people are living in families that are impacted by the benefit cap, and a really big increase that I know you as county councillors have been very concerned about is the increase in entitlement to free school meals. 40% increase in the last year, and it's still growing at a rate of 0.5% a week, which is unprecedented. Rowntree talks about the way that we can tackle some of these issues that arise through poverty. And some of them are out of our control, obviously, as a local authority and a part of the sort of national government programme. But an awful lot of them too need support from the district and borough councils, from the voluntary sector, from the health sector. This isn't something that we as a county council are either responsible for, accountable for, or can solve on our own, and we need to work with a number of other agencies in order to have those. But some of these, like the sort of some of the education and raising skills, strengthening families, they obviously do fit very, very clearly under the remit of us as a local authority and of this panel. And this is the sort of detail behind what Rowntree have said there. And again, these are things that you'll be able to see that we're already tackling within children's services, and we already have policies, strategies, programmes to support. We have our family centre programme and Families First, looking at supporting people to be good parents, and accessing affordable childcare through our early years strategy and Closing the Gap. Education, working with Hearts for Learning and with our schools to get our children and young people into a place so that they can access the education or the learning and the employment that they need later on in life. Employment here is about making sure that families can access, make the best use of the income they can access, whether that's benefit advice, whether that's making the best use of the income they have got, budgeting properly, cooking on a budget, and so that we can reduce the stress in families, and increasing long-term employment opportunities, particularly for our children and young people, by making sure they have the right skills and access to employment and learning when they leave school. We talked a bit about health before, targeting health equalities and the access to green spaces. Fuel poverty is a lot of the work that Hearts Help have been doing over the years. Again, helping families to access the support that is available out there. As I said, a lot of these things are already happening. They're programmes that we'd already started, and there's more emphasis on them sort of since really the autumn. Now that schools are back, we're looking at how we can do the catch-up, awful phrase, but how we can look at supporting children who have had this gap in their education, and particularly children with SEND and disadvantaged children, looking at the summer programmes that are coming up and making sure that there's enough school places and the right school places for these children. YC Hertfordshire have a skills strategy and are working on improving young people's life chances, again, particularly the most vulnerable young people and our care leavers. And we're working together on our early intervention and prevention strategy across intensive family support teams, Families First, our family centres, our early years providers, to try and reduce that demand on our high cost specialist services. We've already had some support over the last few months, and we need to sort of consolidate that and make sure that it all works together so that we make the best use of those resources. I know that you've already had reports about the Winter Support Grant and the good work that's gone on there. Our holiday activities and food programme, which is now called Happy, and the investment that members have put into free school meals are all part of the sort of crisis offer that we have in place to help families. COVID was very much an adult's illness. It impacted adults and older people far more than it did children. And there's now a realisation across the system, local government and health, across public services, that we need to prioritise children, because certainly during the first lockdown, a lot of health services were paused for children while staff were redeployed into the adult sector. So it's about sort of picking up that prioritisation now for children, looking at what's happened over the past year and how we can mitigate some of that impact. And we're working with Hertfordshire and West Essex Integrated Care System on health inequalities and a population health management approach that really fits nicely with this work, because we know that in the more disadvantaged areas there's more likely to be poverty, there's more likely to be health inequalities. And leading on from that really is where we've got to thinking we need to have a coordinated, a consolidated, a collaborative, lots of C's there, approach to how we respond to poverty in Hertfordshire. And this isn't just about having another strategy, another document, a bit of paper. It's how we can work together to tackle the issues that families and those without children will be facing. So this is a sort of an all-age programme. Our current thinking and a small working group from officers within the local authority have been putting their minds together on this, thinking about how the county council would have a key role in framing and co-producing any strategy, any programme that emerges, but that this would have to be delivered by collaboration and coordination, working with the range of partners I've got there, and there will be others, with families themselves, but with district and borough councils, voluntary community sector, health commissioners, housing associations have a key role to play, and schools. And it's how we can make the best use of the capacity and the existing resources and the existing offers that are out there, and have a sort of a place base. It's going to be different in all areas of Hertfordshire, but how we can have a sort of an umbrella programme so that we can make sure that we do make the best use of what resources we have. At this stage, we're not anticipating any future investment, but obviously if that emerges through the needs analysis, through the work that happens, then we would go through the IPP process and procedural processes to look for funding to take that forward. So that's very much a sort of a whistle-stop tour of how we've got to where we are. What we're hoping to do next is in April get together a range of colleagues from across the partners that I've listed there to start sort of thinking through how would this look, what would this look like, what would we want to do across the system. That's me.
Okay, lovely. Thank you very much, Sally. Thank you. Am I echoing? Yeah. could you all make sure your microphones are off, because I'm echoing a bit. Is that better? Thank you. Yeah, so that's a big piece of work we've got coming up in council here. Every department's looking at recovery and how best we can work to help our residents come out of the COVID, out of the pandemic as best we can. It's certainly a cross-sector piece of work. And very much place-based. And I think we've had a good bit of learning, though, during COVID, how we've all worked in partnership across the whole county with all the sectors. So it's about building on that again. So, colleagues, we're interested to hear what you have to say on this. And then officers can hear your thinking about going forward. So, first of all, I have Nigel Bell, followed by Anthony Rowlands.
Thank you, Chair, and thanks, Sally, for your report. But I'm interested, did you say this is going to involve everybody, obviously the districts, and obviously I assume many voluntary groups, and obviously the family centres, but that there is no, obviously, more money available at the moment, but that if any more resources are needed, it will have to be included in the IPP, well, obviously, I presume, for next year. But if in all this work, maybe in the next few months, you find that resources are needed in certain areas, either geographical areas or whatever, won't we expect, I presume, from the administration then that money can be made available, going forward in a shorter time span if we find that no, we need this extra money, despite the extra that was put in for children's services in the budget, that can you can come forward, or maybe Teresa can make clear that money could be brought forward before the end of the year, maybe. Okay,
can I ask Jenny to respond to that, please?
Yes, of course. Thank you. And good question, Nigel. And we would obviously have to take it through our normal financial planning process. However, the council is putting aside some money for recovery, as you know, this last year and this coming year, and this would be part of that work. But it's really important, as Sally was saying, that we take a partnership approach here. It's not just the county councils. So we build on what we're already doing and then look to see where there's a gap in terms of what will be needed going forward, because and I'm sure Teresa will say the council is very much and partners want this to be a sustainable project which builds on the areas that Sally was talking around skills, around prevention, around looking at areas where families get into challenges which then increase the likelihood of them falling into poverty. So it's a whole range of programmes really, and bringing that together. But absolutely, Nigel, if that's required, we'll take that through the planning process.
Okay.
Yeah, so I can absolutely confirm that, Nigel. We have a recovery fund. It's there. I can't remember the figure off the top of my head, but I think across all council it's 11.7 million, but I might be wrong.
It's less than that. All right, thank you.
Okay, so it's there. Thank you. So Anthony.
Good morning, and thank you very much to Sally for that presentation, which I thought was absolutely exemplary in terms of clarity and concision. It's always dangerous just when one makes trite comments, because a lot of this ground has clearly been subject to so much correct comment and consideration over the last year or so. But I'm just thinking it's a fast changing picture, and the children have only just gone back to school, and thinking back to previous lockdowns, many of the people we were talking to, particularly in schools, saying that it would take time for the real problems to reveal themselves. And I'm just really, I suppose, asking what is the intention in terms of continuous review and perhaps reporting back. Maybe it's to this panel. We perhaps have the clearest ownership of the issue. And I'm just thinking ahead, really. Obviously, it's to the next council that we should, I would have thought, be very regularly reviewing where we've got to and what the emerging issues are, so that we're confident that such steps as we can take are being taken. Thank you.
Yeah, obviously, Anthony, I can't talk for a new administration because I don't know. But I know that officers are committed to following this through. And there will be regular updates. I also can't say what sort of committee structure, panel structure there will be. But again, I can say that I know that officers are committed, and I know this is a piece of work I think is going through Senior Management Board as well. So where it's going to come, I don't know, but I can assure you from talking to officers that it will come somewhere and there will be regular updates. And as in Children's Services, we keep a close track of all our statistics, all of our performance. So that's always happened. So that will continue to happen. So I hope that's sufficient for now. It's always very difficult, isn't it? Into an end of a term.
I absolutely hear what you're saying. In a way, I suspect you're looking for a sort of. I'm sure that all the panel, the current panel, would feel that that's something that should happen and will happen. Thank you.
Absolutely, absolutely. It's one of those things that's at the sort of centre of my thinking, as it were, has been for a little while now. So I will ensure that anybody following from me takes it on, as it were, on the nose. So we've got, I've got Dee, then I've got Mark.
Thank you, Chairman. Can I just say, excellent report, very well written. May I make a suggestion? I noticed that you was talking about the voluntary sector and local charities, voluntary organisations helping out, which is very, very important. May I make a suggestion that the CVS will be included in this at all? Yeah. I think that's very important because they've got a lot of different arms out there to connect with local people, and maybe local county councillors could be invited to attend at least one of the meetings, because I know we've got the knowledge on the ground floor, so to speak, and maybe we'd be able to be useful to having a little bit of input in this going forward. But excellent report, and thank you for your hard work. Thank you.
Yeah, thanks, Dee. Yes, I think it's important that we do work around the county, officers will work, and we need to think about that in our modelling, I think, for recovery as well, how we can use local knowledge. I had assumed CVSs were included. I tend to talk about them with all the voluntary sector, so that's great. Fine, thank you. Mark.
Thank you very much, Chairman, and Sally, it's lovely to see you again. Yes, it's we've missed you. But anyway, just obviously, I absolutely endorse this report. What I was trying to get clear in my own mind is we're talking about recovery, and recovery is therefore an interim by definition. Otherwise, we're always going to be recovering. What I see here is something more fundamental, actually, the way of future working, possibly, the way you are incorporating the broader groups into some sort of cohesive approach. And I just really wanted to get assurance that what you're learning from this recovery process will then be adopted into some form of wider form of working with districts, with the health authorities, with the voluntary sector. I mean, if you get it right, it could be fundamentally game changing. So that was really my comment.
Yes, Mark, I agree entirely. And as we have seen that across all sector working during COVID has worked. However, you know yourself, excuse me, that it is quite difficult always working together, and it's something we would strive to do. Dee, can I ask you to stop sharing your screen, please? Yes, so that's taken, but shall I ask Jenny just to comment on that, because Jenny has to take that forward, as it were.
Yes, absolutely. And as Sally was doing the presentation, I was just reflecting on how the last year has really embedded that partnership approach, but a broader partnership for the council and children's services, whether or not that's the front line or strategically. And I think has moved us on. We've always been good at partnership work, but this has moved us in a sort of deeper and broader way, which this programme will require. So a good basis to build on. Thanks, Mark.
Yeah, absolutely. So this is sort of the first of many reports. So I will, I suspect it'll be the first meeting after with a new council, if something will come back. OK, are there any more? I can't see any more hands. Do shout if you've put your hand up and I can't see it, but I've got participants up. So as I've got participants up, I can't look at chat, but I'm assuming there's nothing there. In which case I will be asking members to vote in chat, and members are invited to note the content of the presentation and that of the report. So could I just ask you to indicate in chat, please? Sorry, I couldn't vote. I was chasing the purple boxes. Anyway, so that's all been agreed. So thank you very much indeed. So thanks, Sally. That's really useful. Thank you.
Thank you.
So we're now moving on to the next
Chair.
item. Yes, Nigel.
Sorry to interrupt. You did promise at the last full council that you would give a report back to this first meeting on knife and gang crime. You replied, and also Elaine Shell came back with a report, said that you would come back to this first meeting.
Yeah, I don't think we've been able to pull that together, Nigel. Jenny, can you respond on that? We did consider it.
Yes, absolutely. The serious violence strategy, which includes, Nigel, a report around knife crime, is being reviewed at this moment in time and refreshed. And we'll be ready for the first panel. I mean, normally we'd have probably been coming back, wouldn't we, in April or a bit earlier. But certainly, I'm pretty sure that it will have been refreshed by the time of the first panel after the election.
Yeah.
Okay, I'll put that out because there is concern. A lot of people.
Yes. So I know that the Police and Crime Commission is pulling together stats. So there's the stats coming across the whole sector, NHS, and it just takes a little bit of time to get all that together, because I know that colleagues were interested in statistics as well. I don't know if Joe Fisher's here.
I am, Chair. Hi. Yeah, as Jenny said, it's actually on the forward plan to come for the first panel once we've got through May. So it is on the forward plan, and it is exactly as you've described, Chair. It's because of the partnership approach around that, so making sure that we've got data across the partnership and a coherent picture. So the reviewed serious violence strategy will be coming, and as part of that, the young people's impact on young people will be embedded in it.
Okay, as long as we know what's coming. Okay, thanks very much.
Great, thank you. So where was I? Partnership data analysis and impact of the pandemic. So this is an important piece of work, because you can't do things or know what you want to do unless you've got the evidence. And for us, it's about the statistics. And Paul Dryden, who's the Senior Performance Improvement Manager, has been working to try and pull some statistics for us. So, Paul.
Hi everyone. So basically, just to sort of give an outline, hopefully everyone's read through the report that's been circulated. But the plan is to look at the impact of COVID over the last 12 months or so on young people, but looking at it through a lens of all of the different partner agencies that work with children and young people across Hertfordshire. And pulling that together all in one place. So what we've asked partner organisations to do is to sort of pull together a short briefing around the impact of the work that they've had, health outcomes, education outcomes, well-being outcomes, pull all of that together, and then we're going to pull that together, summarise it, and then look at what the findings and see what the sort of overarching sort of viewpoint is, and sort of pull it all together in one place. We know that different organisations have done pieces of work individually, but there's nowhere that's actually pulled all of that together in one place. And we think that actually we're ahead of the curve sort of nationally on that as well. So we might find that when we've done this piece of work, that it's something that we want to share sort of wider across the country, actually, to sort of show how partners can work together and show that learning about the quite considerable impact that COVID has had on young people.
Yeah, thanks, Paul. So I just say I know that colleagues across the country in various authorities are quite jealous of the relationship that we have with the NHS, for instance, that we're able to pull together the information that's needed. So that's a fact. So I do know from my LGA role that we're well advanced of other authorities as well. So can I ask colleagues if you have any comments, observations about the report, any questions? Have we missed anything? This is your opportunity to feed in. I'm not seeing any hands. No, I'm not seeing any hands. Oh, I've got one. Anthony. Anthony, yes.
Yeah, I just put my not to. So I'm not sure I can get my can get my camera on. Yeah, this may well be incorporated in the list that we have in the paper. But I just wonder and I noticed the Herts parent carer involvement. I just wonder whether there's going to be are there any means by which one can engage with parents as a broader body, because one appreciates that the experience of parenting, and I'm far too old to have young children now, but the experience of parenting has been something that's been unprecedented, and I don't know whether we're going to engage with any bodies. I mean, I know that a lot of parenting groups and counselling sessions are offered. I just wondered which of these many potential consultees would provide that voice.
I think family centres will pick up some element of that, because certainly the main interaction is with the parents there. I'm trying to think. I don't know what forums we have for sort of. Obviously, we have specialist groups, but I don't know what forums we have for sort of speaking to parents. I know we are including the views of young people, but I don't know. Yeah, I don't know how we square that actually and get that information.
Joe, have you got a?
Yeah, absolutely. I mean, we are considering how we involve the views and experiences, the lived experiences, both our parents and families and young people, as Paul said. So we'll be thinking about how we engage with parents through family centres, through HPCI, but other parent forums too, to really think through. And we're already doing a lot of that work. So we're pretty much capturing some of the stuff we're already gathering and thinking about how we bring in the qualitative part to complement the quantitative data that Paul's looking at. And one of the really key things, I think, is to capture the lived experience of young people, as Paul said. So this week and last week, we've been gathering the views of some of our children in care and their experience, their lived experiences of the pandemic and what that looks like. And we're thinking about how we build on some of that and really capture that to set alongside. So we've got a holistic picture of what the experiences of our families and young people have been throughout the pandemic, and how we can therefore use that to inform our strategies and our priorities moving forward. So I think you raise a really good point, Councillor Rowlands, and it's certainly something we're very keen to embed in our approach.
Yeah. Jenny?
I was just going to say, at the same time as this piece of work's going on, the health and behaviour survey for young people, it's an extensive survey by Public Health is being done, isn't it, Paul, and will feed into this. So there's other pieces of work which will feed in.
Yeah.
Thanks, Terry.
I'm sure that through our work with the Schools Forum, and we have governing body briefings, etc., that something could be put out to parents at schools to feedback. I mean, it's a big piece of work, but it's something that governing bodies, I think, perhaps could be asked to do for us. I'm sort of not committing them, but I think there are ways of actually getting feedback from parents via the schools, and it's just a matter of having a survey or somewhere where they can go online to respond back. So I think potentially that's one of the ways, but if colleagues have any suggestions, do let officers know. Is that all right, Anthony?
So, thank you. I wasn't in any way suggesting that it's an opportunity to create something completely new. I suspect those conduits for feeding information back are there, but I think it is an extraordinarily important voice, and obviously also grandparents an extraordinarily important voice in terms of their experience and what we learn and what people learn that may benefit children going forward. Thank you.
Okay, thanks. Yes, absolutely. Okay, so we've got Dee, Mark, then Nigel.
Thank you. Again, excellent report. Can I make a suggestion that maybe the local youth councils can be involved with this? Because I think it's really important that we get the voice of the young person. And I appreciate that the 10 districts all work slightly different. And I don't mean to be parochial with this, but Broxbourne has got a very excellent Broxbourne District Children's Trust. And I think maybe if you could contact the lead officer at Broxbourne Council, that might be useful. That for that particular area in East Herts. Thank you, but excellent report. Thank you.
Yeah. So Dee, just on that, I know that YC Herts does use feedback from the youth forum, so they wouldn't be forgotten at all. That's our main bit with the district, so that's really important. So thank you for that. Mark.
Well, mine's going to be very brief because, yes, I absolutely welcome this approach. I think it really follows on from the same approach that the previous report came to us. I was going to suggest, is it too difficult for the county to put a consultation, a survey, something up on its website and advertise the fact that we're doing this and just put it out through our normal communication areas, just to let everybody, we can filter what we get back as we wish. You know, it can be, people have to say what they are, whether they're a grandparent or parent or just a, so and so. That might open up some new avenues, because bless their hearts, I've got huge respect for the HPCI. We turn to them, and almost any sort of issue we have, I wonder how they cope, actually, because they're a very small, dedicated team. So I think we are in danger of relying too much on a very small group of particular motivated individuals, not necessarily able to reflect the breadth of feeling and thoughts out there in the wider community.
Yeah, no, absolutely, Mark. And I'm sure that something probably will go up as a survey, but that's why I said, we need to use other groups, so governors, school heads forum, etc., to bring in, if I call it the universal parent, rather than those parents with children with particular and special needs. So that's really important. Thank you. Nigel.
Thank you, Chair. And yeah, like others have said, I mean, it looks like a same sort of extensive report as similar to what, obviously that's more detailed maybe than what Sally said in the previous item. But yeah, it's good that you're looking at all various different bodies. And also I'll mention, as Mark will know, the ESCs, particularly Chesbrook where we are, but across the county, and governing bodies. I know school governing bodies, I think, that's even more to do, but I mean, it's very important they're involved. And also whatever ways we can get across to, organisations and that represent obviously Black, Asian and minority ethnic communities, which we all know the disproportionate impact that COVID's had on those groups, and that, in different districts, obviously there are different organisations representing those, but I hope that the county will have the the ways of getting in touch with the different ones in maybe liaise with the districts if they're missing out on getting in touch with key groups. Thank you.
Yeah. So thanks, Nigel. Yes, we have got good connections with key groups. I know that's particularly relevant. I know that Public Health works with them quite a lot anyway, and then there's the religious fora, etc. So I think we're covered, but can't swear to it, but we'll certainly do our best to capture everybody. Again, this is a piece of work that officers have started, and you can see what next term's going to bring, the type of work that's going to be carrying on. So thank you very much. So I haven't got any more hands, so I have to assume there are no more observations or questions. And so once again, Cabinet Panel is asked to note and comment upon the proposal for the proposal contained in the report. So please could you indicate in chat, colleagues? Okay, I think we're all right. That's all gone through, hopefully. And keep up with the purple boxes. Okay, thank you. Paul, thank you very much. It's going to be an interesting piece of work. And I know that you're going to carry that. I think you're going to look at that regionally as well. I think that's going to come through. So, yeah, thank you very much indeed. Thanks. And so another piece of work that we did promise to bring back to colleagues is an update on children and young people's mental health and emotional well-being. during the pandemic. A very important piece of lots of things have been going on here, and great concern, I know, for members. So we've got Deborah Shepherd, Senior CAMHS Commissioning Manager, Integrated Health and Care Commissioning Team. Hello, Deborah, how are you?
Thank you, Chair. I'm good. Thank you for asking. I've got some slides which I'll just pop up onto the screen for colleagues.
Thank you.
If you could just bear with me for one moment. Okay, could I just have confirmation you can see them?
Well, I can see them, so I'm assuming everybody will eventually.
Wonderful, thank you. So thank you, Chair. So I'm Deborah Shepherd, I'm the Senior CAMHS Commissioning Manager. I work in the Integrated Health and Care Commissioning team. So we work on behalf of both the clinical commissioning groups and Hertfordshire County Council. And I'm presenting these slides on behalf of the CAMHS system, where all of commissioners, providers and other stakeholders are working together to plan, deliver and evaluate our response to children and young people's mental health. So just to pick out some key points from the paper that you've all read, I thought I'd put some slides together just to go over some of those key points. So the first slide here, just reflecting on what we know about children and young people's experience of the pandemic and lockdowns and how this has affected their mental health. NHS Digital do a survey to determine probable mental ill health in school-aged children and young people on a regular basis. That's where we get our national prevalence data from. The NHS completed a comparable survey last year and found that rates of probable mental ill health had increased from approximately 12% to 16%. The sample for that survey was small, much smaller than they would usually use. So we do need to be cautious about the findings, but I think it's quite likely that we can safely say children and young people's mental health has been negatively affected by COVID and the restrictions around that. The survey and some of the data that's been provided by Kooth, which is our online counselling provider, has found that problems within the home, including forms of abuse, changes in sleep and access to school support, were factors in this possible reduction in mental health. We've sought feedback from our Hertfordshire children and young people regularly throughout the last year, checking in with them through surveys and focus groups as well. We did this at the start of lockdown, again in the summer and again at Christmas. And this helped us to plan our response and feedback to stakeholders so that they could increase their understanding of how young people had experienced the last few months. Ultimately, most children and young people were pleased to return to school in September, but more were unhappy than before the pandemic. Public Health are in the process of analysing nearly 13,000 responses to the Young Person's Health and Wellbeing Survey that you just heard about, and that will provide further insights. This slide focuses on how services were affected and how we responded to the changing needs. So one of the first things that we did was centralise our resources and communications to simplify access to information for professionals, GPs, schools and families. We set up a helpline for children and young people with Mind from very early on, and crisis support that was already available was extended, so it was available 24/7, and that happened nationally. A range of support was provided to schools. One of the first things that we did was commission bereavement training, and the Educational Psychology Service developed some fantastic resources for schools about how to support a young person that had experienced bereavement. That was followed by the Department for Education funded Wellbeing for Education Return, which is a nationally funded programme to support schools to understand how to support young people when they return to school in September, how to respond to their experience of lockdown, increase their resilience. And 3/4 of the schools in Hertfordshire have attended that training so far, which will be rerunning later in the year. So most people will be aware that a lot of services had to move on to online and telephone support initially in order to continue. Face-to-face support was provided where that was clinically necessary. And we've found that the outcomes from delivering the support online or through the telephone has actually had similar outcomes to face-to-face support. So where people feel that that is convenient for them, we hope to be able to continue to offer those options going forward. We noticed that for some services, referrals dropped off during the first lockdown, but then they peaked again over the autumn. However, across the whole year, mostly referrals have stayed about the same. They evened out, and caseloads remained the same. So we know that our services continue to work at or above capacity. However, the changes that we have observed are that children and young people that are presenting to services often have much more acute and complex needs. There have been increases in crisis and eating disorder presentations, and this is something that's been observed nationally. We've also seen demand increase for inpatient beds, which is again something that's happened nationally. The question about how children and young people's mental health needs will change as a result of the pandemic is the subject of much academic modelling. However, the pandemic is completely unprecedented and therefore predictions do vary. From Public Health and the Centre for Mental Health tools that we have used locally, the expectation is that increases in low mood and trauma will be observed particularly, as well as anxiety to a lesser degree. Now, we don't know what time frame this relates to. It's unlikely that this number of children and young people will come forward with these needs all at the same time. We know with trauma, for example, that can take many years to manifest. So we could see this increase over potentially 10 years. So because that's a challenge for us, the Mental Health and Learning Disability Integrated Care Partnership have commissioned niche consulting to gain a real-time picture of demand, so we can model the growth accurately, and that will help us to inform our strategic response in a live way. We've already acted on changing needs and we continue to do so. So we've provided additional funding to our community counselling partners. They've increased their capacity. We have put additional all-age bereavement support into place. We, as I said before, have got this new helpline from Mind, which is really helpful. And we're just making sure that we're signposting people, ensuring that professionals and children and young people know all about the support that's available to them, including some of the national apps, Kooth, Chat Health, which is a text messaging service delivered by the school nursing team, and what to do in a crisis, for example. Existing plans to expand and transform our services will contribute to responding to the potential increased need in the future. And we know that additional funding was announced in the NHS spending review last year. That's been specifically allocated to meet the additional demand predicted as a result of the pandemic. So we're just waiting for further detail on that from NHS England. I'm going to hand over now to Jo Fisher, who's going to do a spotlight on YCH services for young people and how they're contributing to the emotional health and wellbeing work.
Thank you. Oh, it's a bit of an echo, Deborah. Yeah, thank you. Good morning, everyone. Yes, Deborah talked a bit about some of the surveys we've been doing with young people, and you'll know from that the light has now really been shone on the impact of the pandemic on children's mental health and emotional well-being. So I thought it was quite important just to flag to you a couple of examples of the kind of work we're doing within the council, but in partnership with our health colleagues as well as those in the community and voluntary sector to support young people with their emotional health and well-being. First of all, YCH services for young people. You'll know, many of you already, that YCH provides a significant amount of one-to-one support from our youth workers for young people who need that level of one-to-one support. But alongside that, there's a wide and broad range of group work projects that we are currently running and looking to extend throughout the year. Supporting young people with their emotional and mental health is embedded in a number of our mainstream youth work projects. For example, our empathy hospital work for young people, I think, is a great example of that. And shadowing it last year, I saw an example of how young people work alongside youth workers to support young people who've been admitted through the A&E department at the Lister and the Watford Hospital. And that not only, and it's an opportunity for them to meet with the young people, to talk through some of the challenges and concerns they might have. I saw not only the impact that has for the young person who's been admitted to the hospital, and indeed their parents, many of whom are really thankful for the support they get, but also in talking to young people who take part in the training and the support through the Empathy Project, seeing how just taking part really offers the opportunity to mature their emotional well-being. It's a great project. The Go Wild is another example of how we do that. The Go Wild at Hudnall Park, which is a partnership with Hearts and Middlesex Wildlife Trust, really focused on getting out there, engaging in the natural environment, and doing so improving your emotional well-being. So there's a lot of sort of universal type support embedded in our mainstream youth work projects, but we've also got some more targeted support. So for example, our new Healthy Lifestyles project, which we're set to roll out through the summer holidays, providing both emotional support, advice, information, some activities so that young people are better informed and able to understand their experience of healthy eating, regular exercise, getting sleep, how that helps with their emotional well-being, making sensible and healthy lifestyle choices. So again, there's some really targeted programs of activity happening. And lastly, just to flag the Happy programme, which is our healthy eating and activity program we're rolling out throughout the summer, as well as Easter and Christmas holidays, with a real focus on providing activities and healthy food to children who are eligible for benefit-related free school meals, as well as all children within Hertfordshire, but free at the point of delivery to those eligible for free school meals. So there's a lot being planned too. And lastly, I just want to flag Safe Space, which again is our in-house counselling support service for young people, typically provided through schools, and we've got a number of our contracts with, I think, over 70 schools now across Hertfordshire. But the offer is much broader than that. Many schools spot purchase the support. And looking at the numbers of children that we've supported just this year, throughout Q1 to Q3, so up until the end of December, we supported 478 children, young people, as well as over 40 adults, so professionals who needed support, often the teaching staff in school, with their emotional well-being. And we've seen the increase. Deborah talked about how initially in the pandemic, referrals into mental health services dropped, often because schools were closed to many children. But we've seen that increase throughout the year. And when I look at the Q3 referrals into Safe Space, there's a 20% increase to this time last year. So yes, we're seeing that increase of identification of children and young people who've got emotional well-being supports that need early help, and our Safe Space service is a key part of that in providing targeted therapeutic support for children and young people. So that's it from me. I really just wanted to give you a couple of examples of some of the really good work that is already happening across the county, and indeed that we've got planned as we move forward. Thank you, Deborah. Handing back to you.
Thank you, Jo. That was all from me.
Chair, I think that's the end of the presentation, but we're happy to take questions.
Yeah, I had my microphone off. Sorry. Yeah, so thank you very much. Once again, really interesting presentation, packed full of information. And there's so much going on, I know. It's very difficult to know how to communicate it all at sometimes, isn't it? So we have some questions. So I've got Nigel, Anthony and Mark. Nigel.
Yeah, thank you, Chair, and thank you for that presentation from Deborah and all the good work that you're doing and all your staff and colleagues are doing. And it was good to hear a bit more about the Empathy Hospital projects, and obviously again then from Jo about the Safe Space. I'm assuming that you know, because I've heard about it, but not in great detail, but that this is actually getting across to everybody right across the county, not just those who happen to be near the two or three major hospitals. But the other thing is more on a wider thing. Deborah, you said that about that extra money that was offered or that's there. Do you know when we'll hear, or when you'll hear, when we might know how much or how the resources are going to come to the county, and then how we'll be able to use it extra in the county? Thank you.
Thank you. So I think the first piece of information about the split between children and adults has started to come down at the latter part of next week. The funding will come through to the CCG, but then it will come into the Integrated Health and Care Commissioning team. And as I mentioned at the beginning, we work on behalf of both the clinical commissioning groups in Hertfordshire and the local authority. So there will be some planning with our joint board around how to discharge that funding, which has got representatives from both the local authority and from health as well. So I suspect there'll be quite a short turnaround once we do hear about it from NHS England, and probably within the next few weeks we'll be required to submit some plans against that. Oh,
good. So we'll get that to us. Great. Yeah. Thanks very much. And then it was just, or maybe it's to Joe then, about how the empathy project and the safe space. I'm assuming all schools and all across the county know all about that.
They do, and Safe Space works with many schools across the county. Our youth work projects are district based; they're across the county, and the Empathy project is located at 2 of the main hospitals, as you may well know, Councillor Bell. But again, we promoted that through our sixth forms and through our schools to make sure that young people are aware of it, both to take part as one of the youth workers going to the hospitals, but also, once they're in the hospital, we work really closely with the wards, the nurses, the doctors on those wards to make sure that they're promoting actively to young people who have come into hospital for whatever reason. So I am confident there's quite a lot of visibility about this provision. Obviously, we've got the YCH website as well, and again, if you look at that, there's a huge range of district-based activity happening, and I know that again schools are active in promoting that website so that young people know how to get help for themselves if they need it.
Okay, yeah. Thank you.
And obviously all schools are aware of the Public Health Just Talk programme. That so there's quite a lot out there for young people, but we just have to keep making sure. Can I just ask before I come on to Anthony? We know there's a lot of information out there, but are you able to tell off members where they can best point residents to find out all this information? Because it's really quite difficult sometimes. Deborah?
Yeah, so I think that is something that we're definitely working on. We've just recruited a comms and engagement manager to work across all of our partners in the CAM system so that we can get all of our information in one place. I think if you're somebody that works in a school, you'll have access to that information because we have a programme of recruiting and training mental health leads in every school, which is a well-established programme in Hertfordshire, and they are constantly fed information and know exactly where to look and how to access that. And we've also put together an information hub that we're piloting at the moment, just to really help with that volume of information that's coming through to schools. And if you're a GP, you'll have access to that information because we have very good channels of communication with GPs via the clinical commissioning groups. I think in terms of getting that information out to the wider public, it's challenging because there is so much information out there. It needs to be in a format that people can readily access. However, we have produced a signposting guide that we've been sharing quite a lot over the last few months, which I'll happily share with the group if people wanted to use it with their constituents.
Yeah, I think that would be useful, Deborah, because I mean, I know where to go and look, but I have to go to several websites to find it. So if you could share that with members, that would be very useful. Thank you. And your presentation, if I could say. Thank you. Anthony.
Teresa, thank you. I think your last question was particularly pertinent. I mean, a lot of us will be, as it were, meeting residents over the next few weeks, and they may well ask us, where do we get information? And we're worried about our children. We know we can talk to the school, but they independently want to know where they can get information. So I think, yeah, for us to be aware of something like a signposting guide would be really useful, because, as you say, it can be very baffling, and particularly for people who are perhaps already anxious. Again, a really good report and presentation, and obviously it highlights the escalation in concern about young people's mental health, and I think it sort of helpfully links into the actually the 2 reports we've already discussed this morning, and clearly there are an enormous number of connections there. A couple of questions and one other comment. I think this was hinted at, I think, in what you and Nigel already talked about, but the in paragraph 515, there's the reference to the crisis support, the 24/7 support for young people to try and avoid situations where they end up an accident, emergency, and in fact problems then it can be exacerbated by their experiences. The end of that paragraph is a little bit uncertain as to how that is going forward. Maybe we could just have clarification as to what will be happening after the end of March for that service. Second question, and Mark and I have talked and had a very interesting, useful briefing with Deborah about the mental health support teams in schools, and I'm just wondering, so much of what we're talking about, and you know, all the examples that Deborah has given and Joe have given have been really heartening. And how are we doing, and how are those various services doing in terms of staff recruitment and literally capacity to do all this work? Because it's person-intensive work. It's individuals talking to young children. It's enabling things to happen. And I just wonder, in terms of recruitment into this field of work, how are we faring? And I suppose the final point I just wanted to make, and again, and this is I have to say, me not being cynical but being incredibly disappointed. I mean, we've got the money, 500 million is going to be discharged across the country, but we're still waiting to see I know we've had some information about how that's now being percolating down, but when you see 500 million and then you read 37 billion on test and trace and the scandalous lack of accountability, it does make me feel, and I associate myself with the cynicism a lot of people have, that we're not using our resources as well as we should. But that doesn't extend to the county council. I do understand all the work you've been doing and appreciate it. But I think in the wider context, we've got a lot of questions to ask. Thank you. There's a couple of questions in there, Teresa. Thank you.
Yes, thanks, Anthony. Obviously, no comment about national, because we're here today to talk about the county council and its delivery. And as you say, I think as a county council, we do extremely well in making sure that everything we have is used and delivered in the best way. So Deborah, could you answer the other questions, please? Thank you.
Yes, of course. So just also a reminder that Hertfordshire Partnership Foundation Trust, who provide our statutory specialist mental health services, they do have a single point of access, which is contactable 24/7 with a 3 phone number for people to get access to advice and support. I think that's probably more sort of service focused, but it is there. So I did want people to be aware of that. In relation to the crisis support, we've been working with our providers to develop a model of integrated crisis provision for quite a while, and obviously that work has become stretched out because of COVID, but we have a model that everybody's agreed on, and that will be going to our board next week for approval. So all of the time scales for how long that service will be available for is in the recommendations, one of which is to remain 24/7, but we looked at the data, so we'll make an informed decision based on when people are presenting to hospitals requiring crisis support. So that's what will follow. Basically, we've been working very closely to have an integrated support offer, because we recognise that not all young people that present in crisis have got an underlying mental health need. They may not need mental health treatment. They may just need some mentoring or other support to get through a particularly challenging set of days or weeks for them. So that's what we're trying to recognise with this model. In terms of vacancies, I think this is a fairly stable picture. Obviously, we do suffer the effect of being on the borders of London, but that doesn't seem to have exacerbated situations. There's been a lot of work to support frontline professionals, support their mental health in physical health services, mental health services, social care, and HPFT have been at the forefront of establishing a region-wide support programme, the name of which escapes me, which I'm very disappointed in myself for. I think it's called Here For You, something like that, but really nicely branded programme of support for our frontline workers, and I think that will really help us to retain colleagues going forward.
Okay, thanks. Thank you. And I think it's important for colleagues to remember that emotional and mental health shouldn't be, I should say, always medicalised, because actually a lot of the pressure that people are suffering or have suffered, I should say suffering now, because I think this third lockdown's been the worst of all, that's personal comment, is about how we can get out and do different stuff. You know, you either go physically, so you've got Heart Sport Partnership, for instance, working with all the sports clubs, trying to get young people out there. You know, is trying to push now again healthy walks across the county. They're starting sometime, I think, next month. So that it's about how we can do things for ourselves to keep resilient and lift that burden. We don't want people to have to take tablets and things like that, because it's gone too far then, hasn't it? So this is early intervention here, and I'm hoping that's what county's providing. Okay, so Mark. Yeah, Mark.
Thank you very much, Terry, and thank you very much, Deborah and Joe. The one sort of thing that I'm hoping is that we're looking at the blackest picture at the moment. We've just come out of this lockdown. As you said, the third lockdown's been the worst. A little story, and it's a very quick one. I mentioned my daughter teaches at the Priory School. They went back last week. 10 minutes, she said, something like that. Everything seemed a bit odd. And then within about an hour, the kids were back knocking hell out of each other and getting back to being normal kids in a normal school. And what I'm really trying to say is, of course, what you're addressing is real and deep and widespread. What I'm hoping is that also children are incredibly resilient, and a lot of them, once they get back with their peers and in a more stable world, a lot of their problems will go away. So what I'm actually saying, and of course we're going to do it, I know, is we desperately will need a report in about 6 months' time. Then the picture will be a lot clearer. And the other comment, just to say, well, I picked up in the financial impact paragraph, it is only a short one, that it's very hard to assess the financial situation here. And it goes back to, I don't know, we're all assuming that we will be here in 6 months' time. Those who are lucky to be on this A panel will want to know how this is all actually worked out. And the final point was, I picked up particularly about the 24/7 and really relating to that, and the comment you just made, I think, yes, we're going to have to sort of, we do it virtually everywhere, is just have a kind of measured level, a sort of graduated level. At the moment, we're just sort of piling in resources because there's a problem, but out of this will become a mature approach which will assess the real level of need at the different levels and then resource accordingly. So if ever a report needed to come back in, I say 6 months, I'd be guided by the professionals, but in another period of time when the picture has clarified a bit, I think this is one. Thank you.
Yeah, absolutely, Mark, quite agree. It will be back. Jenny.
Thank you, Terry. I was just going to say exactly what Mark has said, that there isn't just one story here, and really important to young people's well-being is a reopening fully of schools, and schools and head teachers certainly are very much aware of that extra emotional support that they're going to concentrate on really well into the summer term. So coming back at a later date fits in with the partnership data analysis, so we're clear where we need to put our resources for those young people that haven't been able to build that resilience that I'm sure the majority of young people will. Thanks.
Yeah, thank you. Yeah, so I mean, just carrying on from that and carrying on from the previous two papers, we talk about children and young people, but obviously the family is an integral part of where the children are. And that's what we'd be looking at as well, the support for the family, because the child might be okay, but it might be mum and dad that's not actually being too good, especially if they've had to deal with education or what have you, and they might have lost their job. So that's why this all ties up nicely together. Okay, so are there any more questions, observations? Oops. So again, the Cabinet panel is asked to note and comment upon the content of the report. I think we've commented nicely. Thank you, everybody. Could you please put your agree, against, abstain into chat? Okay, so I think we're all right. That's lovely. That's all been agreed. Thank you very much for that. So we're on now to, thank you very much, Deborah. Thank you very much indeed.
Thank you.
We're now on to the third quarter performance report, and Paul again.
Just going to share my screen. Hopefully everyone can see that.
That's it.
Excellent.
Thank you.
So just say I'm presenting Q3 data, so that's from October through to December 2020. I've just picked out some highlights from the report. So obviously after the presentation, if there's any particular parts in the report that I haven't touched upon, please feel free to sort of raise those if you have any discussion points. The framing of this, so we're looking at the overall performance, but also sort of having that lens of looking at how COVID has impacted upon the children and young people and how it's impacted upon our performance. So first looking at our targeted services and early help. So in our Families First service, there was 522 Family First assessments completed during Q3. That's actually the highest number in any sort of 3-month period that we've ever reported. And actually, it's basically a culmination of less contacts and less assessments being carried out earlier in the year, and that sort of period from September to December when schools returned, sort of creating a sort of influx of more assessments needing to be completed. For our specialist adolescent service, the numbers have gone up to 101, so that's not broadly out of line with sort of the pre-COVID period, but a considerable increase on the previous 2 quarters. And just to sort of give an idea of that sort of pressure, so we know from April, the overall number of contacts coming into Families First is 4% higher than the same period, April through to December 2019. However, if you look from the July period onwards, it's actually 10.2% higher. So what we saw is a dip, and then it started to pick up, and that's continued. And one of the interesting things that's sort of come out from sort of analysing the data is that we know now that domestic abuse, particularly in the July to December period, has more than doubled compared with 2019. Moving on to the next section, which is education, health and care plans for children and young people with special educational needs and disabilities. So in the year to date from April through to December, we've had 1,160 requests for an education, health and care plan. That's 4.7% lower than last year. However, if you look at, again, it's the same sort of story. If you look at the period from July to December, the requests are actually up 16.5%. So a dip to start with, but then a considerable increase from that July period onwards. They haven't yet caught up to the level to be in line with last year, but it's not far off actually catching up with that level. And if that trend continues over the next few months, then it's quite likely we might actually see more education, health and care plans being requested than in previous years. For actual plans issued, there's a 12.3% decrease on last year. There was a shortfall in the number of plans that were being completed in previous quarters because families were waiting for health input on their plans, and they rightly so didn't want to complete those plans until they'd had a health input. That's now starting to unblock, so we're seeing more plans go through to completion now. The assessments completed in timescale, last time I reported that it dropped considerably to 67.5%. Really good news is that it's now picked up again, and it's now up to 90.5%, so that performance has improved considerably. We've added a couple of new measures this time around annual reviews. So we know that for annual reviews within timescale, 24.3% have been completed within timescale, and 48.4% have had the Education, Health and Care Plan amended within timescale, so where there's been amendments requested as part of the review. Obviously aware those numbers are very low. One of the main reasons behind that is not that the meetings aren't happening within timescale, it's more to do with the processing and the finalisation of those plans, and a team has been put in December, so we expect that to specifically look at this area, so we expect that to improve considerably in the next few months. Next, looking at referrals coming into children's social care. So when we compare the period from April through to December, we know that there's been 10% fewer referrals coming into children's social care. So the drop in activity is more pronounced than it was in Families First. We have seen increases in those coming in between September and December when the schools returned. However, we had projected it would be much higher, so we projected around sort of 700 based on the referrals that hadn't come in earlier in the year. That hasn't fully materialised, so we've seen referrals come up to a level similar to last year, but not considerably exceeding last year. However, we do still expect to see an increase in referrals. Obviously, this period covers the period prior to when the schools closed again in January. And obviously the schools have just reopened again now, but we're not expecting to see that increase in the current data sort of going up to the Easter holidays, but we expect potentially once things have settled more in schools, we may see increased referrals coming through in that sort of post-Easter period. Next, looking at initial child protection conferences. So when it's decided that there should be a Section 47 investigation to decide whether there needs to be a child protection conference or not, the government guidelines that this has to happen within 15 days of the start of the Section 47 investigation. In December, our performance was 98%. So that was only one child's conference that was out of timescale, and that's our best performance to date. And there's been really strong performance over the last 4 or 5 months. What's interesting, sort of looking at the COVID impact around this, is actually even though we've had less referrals come in overall, we've actually seen a 5.2% increase in child protection conferences. So it actually shows that while there's less children, those at the higher end of need, those numbers are actually increasing. Children subject to a child protection plan, so numbers reduced to 409 at the end of December. They've since gone back up to about the 430 mark, so it was just a temporary blip in December where the numbers had reduced. And just to sort of compare December 2020 with 2019, it was a 12.8% decrease. And historically, we always have had one of the lowest rates in the country for children subject to a child protection plan. Just to sort of talk about the COVID impact. So whilst, and I think I might have mentioned this at previous meetings, but we have been using a mixture of visits carried out by video and face-to-face, and during that initial lockdown period, more visits were being carried out via video, but actually now the majority of visits are now being done face-to-face. And parents, when schools weren't open, parents were informed that all children had to attend school who were on child protection plans. And for those who weren't attending, we asked the social worker to indicate whether they were confident that the child was receiving the adequate level of home education. And that was around the sort of 90% mark, so that was really good. Number of children subject to a child protection plan for a second or subsequent time. So that's been increasing over the last 3 months, and it went up to a peak of 20.3 in November and since reduced slightly to 19.8%. But some further work's been done to sort of understand who these children are and what the reasons are for why they've been returning to child protection plans. Also, those returning within 2 years of their previous plan has also increased to 7.8%. Number of children looked after. So what we've seen over the last, probably about the last year actually, but definitely sort of from June onwards, is that the number of children in care is gradually increasing by about 10 per month. And that sort of culminated in December and us having 1,004 children, which is the highest number we've had for many years. And that's a two-pronged sort of issue there. We've had slightly more children coming into care than in previous years, but we've also had less children leaving care. So some of that has been an impact on the courts. So delays in the courts mean that less children have been adopted, less children going on special guardianship orders, for example, but also our direct work with adolescents and their families to help return children safely to their homes has not been as easy in the sort of with the impact of social distancing, and that's starting to get better now, obviously. So we've managed to do more work. And there's been a task and finish group set up to look at how we can reduce the numbers of children in care, particularly looking at those children where there was a plan to return home prior to COVID, and then making sure that everything's on track to make sure that those children can safely return home. Next is children looked after who've had 3 or more placements in the last 12 months. This is one of the real positive stories from the last 12 months, is actually the number of children who've changed placement more than 3 times has reduced considerably. At the moment, at the end of December, the performance was 8.4%. About 2 years ago, it was about 13%. It reduced to about 11.5%, and now it's down to 8.4%. And to sort of put that in the national context, we were in the bottom quarter of the country, one of the few measures where Hertfordshire wasn't a strong performing local authority, and we've now moved up to the second quartile nationally, so we're now in the top half of the country. And that's a mixture of different initiatives that have been put in place to improve placement stability, including sort of supporting foster carers and making sure that people feel that they can keep those placements stable. And that's despite the additional pressures. So obviously carers are under additional pressures with things like school closures and the young people being around more and not necessarily being able to go out and play with their friends and things like that, which it potentially could have caused more placement breakdowns. But actually our foster carers have sort of risen to the occasion and helped keep those placements stable, which is really positive. Number of children exiting care in the last 12 months. So for those who are exiting via adoption, if we compare it with last year, it was 10.9% in December. It's now 8.7%. And for those exiting to a special guardianship order, that's reduced from 12.7% to 9.4%. And a lot of that is due to court delays, particularly during the first lockdown period. However, we've since managed to work with the judiciary, and those cases are now being progressed, and actually the performance sort of from September onwards is actually an improving trajectory. We don't expect to see as many children adopted this year as in previous years, and that'll be reflected in the national, and certainly is reflected in the regional picture, but it is on an improving trajectory now. The last slide I've got is care leavers aged 17 to 21 in education, employment and training. So that's reduced to 53.1%. At this point in 2019, it was 56.8%. So you can see from the chart that this is quite a seasonal measure, and it does change throughout the period. But if you're comparing the two periods, the number of children in education, employment and training has dropped. And this is one that we really need to keep an eye on over the next year, as we know that young people are going to be affected more by the changes to the economy and the impact upon that in the next sort of 12 months, even after the epidemic potentially is over. So there's a lot of work going on with young people to make sure that they've got opportunities for employment and training. Very much. Have you got any questions?
Thank you, Paul. Thanks very much. Okay. Ooh. Could I ask somebody to turn their microphone off? It might be you, Paul. Not sure. Echoing away there. Thanks very much. Yeah, can I just ask Paul, the annual review figure you gave, the annual reviews for EHCPs, we know is quite low, but more resource has been put into working in that. Are you able to give us an update figure on EHCPs or not at the moment?
I don't have that to hand. I don't know if Joe's anything.
Sorry, is the question? What the question is? It around EHCP numbers, or is it around
annual reviews?
Yeah, I've got the January data, Terry, which is what Paul's shown you on that slide. So I think in January, as Paul said, it was 24.3 annual reviews being done on time in Q3. So we haven't yet had a chance, obviously, to collate our Q4 data, but we are on it, and we've put in place a new team, and we're monitoring that and tracking that and reporting it on a quarterly basis.
Yeah, no, I know. I just wondered, because that was the end of the third quarter to December. I just wondered whether we had anything else, but that's fine. That's okay. I know that it's going the right way anyway.
Yeah.
So that's important. Could I congratulate the teams on improving the placements? A lot of work's gone on there in the fostering service. So that's excellent work. Quite concerned about the number of domestic abuse cases, but I do know that we're working across the sector with the police, etc., on that one. So hopefully we have enough support in there. We are looking at a lot of early intervention, and of course the NEET numbers are a concern, but that's going to come into our post-COVID look, as it were, transition look. Jenny.
Thank you, Terry. I was just going to come in on the domestic abuse just to clarify that across the county there's been a rise of about 9% of police-related contact in that area. And what Paul was referring to was the increase in the contacts that they've sent through to children's services. So across the county, although we've definitely seen an increase, and the domestic abuse partnership across the public and voluntary sector have really been focusing on this and encouraging people to come forward, and we will continue to do so. And in fact, as restrictions lift, we anticipate more people coming forward for support. The increase across the county has been 9%. The doubling has been in the contacts that have been put through to children's services, and I think it's important to clarify that. Thank you.
Thank you. Thanks. Okay, I've got John Graham, then Mark Watkin.
Chairman, thank you very much indeed. An excellent report, and as ever, the performance has been excellent. And Paul, thank you very much indeed by putting the extra box.
Oh, you've turned yourself off, John.
Sorry. Right, okay. Sorry. Shall I start again?
Yes, please.
Chairman, thank you. And as ever, the performance that we see on these slides has been excellent. I mean, you're highlighting some of those areas where we're seeking improvement, Chairman, but overall, I think we're in a strong position. And Paul, thank you very much indeed for producing these boxes that show the COVID impact. And that was the area of my question. And really, it may be a question for Jenny, because I couldn't get the feeling as I go through the reports. Clearly, the staff have been operating in a different manner because we've had to operate presumably with remote working. And I wondered whether there's any comment on whether the different style of working has affected the performance in any way. I couldn't get any feel out of the performance indicators and what was written. Thank you.
Shall I pick that up,
yes.
Chair?
Jenny, yes.
So just to confirm, certainly since last summer, staff have been doing face-to-face work as well as virtual working. So this has been very different to April and May last year. So I just want to make that clear. But the ability to do the intense work, whether or not that's with young people with our specialist adolescent services or indeed our social work teams, has obviously been restricted. And what Paul was talking about in terms of, particularly for teenagers, building those relationships with families, enabling young people to return home, or indeed supporting families when they were having challenges. We do think there's been an impact on working particularly with teenagers, and therefore in terms of our next steps we've taken that all into consideration. So I hope that gives a bit more of a flavour to the work that's gone on. But our frontline services have been out using PPE and doing the very best they can to engage, but obviously in a more limited way than we would have done normally.
Is that okay, John?
I suppose my question was whether that has been whether we've seen any impact on performance as a result of that, because Jenny, particularly you talked about the areas where you've got difficulties. Difficulties to me tend to suggest that you're not, maybe there's a drop in performance, but that would therefore present your figures here in a much better light, because despite adverse conditions, you still performed to a very high standard.
Yeah, I think
it's probably the fact that people have continued to go out and do the best they can in terms of face-to-face. But certainly the 3 or more placements, we are clear there's been a lot of work that's gone in that was there before the pandemic, but the fact there's been more family time, we've had that feedback from children and foster carers, has made an impact in that area. So I can see where you're coming from. In terms of referrals coming in, we do see those beginning to increase, and we anticipate that will happen for the rest of this year as the true impact of what we've been going through comes to the fore, as we were talking about earlier. Sorry, Terry, I cut across you.
Yeah, no. I was going to say, John, I think the one place where we did see numbers rise, and that is the number of children coming into care, I would say young people coming into care, and that's the rise in the adolescents. It's because our youth workers, our SASH team, haven't been able to perhaps get as close as they might want to, because difficult conversations need to be had face to face. Sometimes it's very difficult to, as you probably learnt over the last year, to have difficult conversations on screens and on telephones. And I've heard from officers that that's been one area where it's been a little bit more difficult. However, they've been doing extremely well keeping adolescents with their families, shall we say. Is that right, Joe? You were going to come on and say something.
Yeah, no, I was here just in case, but you said it all, Terry. You're absolutely spot on. I think the team have continued to do some really good work in terms of prevention of young people coming into care. But we know that particularly in November, we saw a slight increase in adolescents coming into care. And a number of those as a direct consequence of the pressures on families due to lockdown and the pandemic. So where we've seen some of the harder areas to work on have been around helping young people return home after they've been in care, and that family reconciliation work that's needed with our adolescents. We saw a slowing down of that in the pandemic, but again, we're picking that up. We're doing some really targeted and face-to-face work on that now too, so we should begin to see that sort of come back on track.
Yeah, thank you.
Chairman, then can we then thank the team for working through this pandemic and delivering such good performance?
Indeed. Thank you very much, John. Yeah, absolutely. Paul, did you want to say something?
I just wanted to give a couple of examples of actually how this way of working has actually improved things. So when I was talking earlier about the initial child protection conferences and how they've improved considerably over the last few months, And one of the reasons why is because when you can set up virtual meetings, that means people like, for example, GPs that may struggle to get to those meetings, and that might impact upon the timeliness. Actually, those people can attend those meetings much easier now because they can come in virtually, they can do their 15 minutes of the meeting or however long they need to be there, and then they can leave the meeting. Also with the placement stability, they've also managed it's much quicker to be able to get a virtual meeting together of all the relevant professionals to discuss about what they can put in to improve the stability of that placement, and they can get back to the foster carer much quicker then. So there are some things that we will keep sort of going forward that have worked really well.
Absolutely. Thanks very much for that, Paul. Yeah, so Paul, you're being asked to stop sharing your screen, officers. Thank you. It's all right. Great. Mark Watkin.
Thank you very much, Terry. And I just want to compliment Paul. I think his presentations are superb. The only thing, I'm going to have a couple of quibbles with you, Paul. I don't understand the exiting care figures. I understand what you're telling us in terms of the fact it's dropped down, but I don't understand what those percentage points are. And just another negative, I think when you're making a point about the number of children coming into care, CLA figures, to show the scale from 1 to 1,000, and the differences are 10 or 20, it's almost hard to make that out. I would suggest you could almost cut out the first 800 and just go, and that would make that story much stronger. I feel nervous and even talking to you because you do such a great job in presenting the data, and there's so much more in your report than here. And just picking up that point, and this is a personal point, sorry, I rather enjoy working on Zoom meetings. It doesn't half get through them quicker than if we go piling into County Hall. You know, a focus meeting like this is done and we get on with the rest of our lives. But I know I'm a bit of a minority and some people love the idea of meeting. The other point I just wanted to pick up on was I mean, there's so much, but I just thought the one that really stood out to me was getting the 3 times placements down, because that represents such a reduction in damage and harm to those young people. You know, that if they get rejected, which is effectively what's happening every time they get replaced, it doesn't just stop, it carries on, and their confidence and their trust in adults is particularly damaged. So of the many things I could have commented on, and I'm not going to waste any more of your time, that was the one that I thought, great, well done. That's something to be very pleased about. But yeah. So my comments on can you just come back and explain to me what those exiting care figures actually, what that 12% is? 12% of what? You know, that's what I didn't understand. Thank you.
Yeah, so no problem. So the exiting care, so there's a whole range of reasons why a child or young person might leave care. So they could be adopted, it could be a special guardianship order, they may return home to their original family, and also it includes children who turn 18 and leave care. So it's of that overall proportion. So say we had 100 children leave care in the period, if we had 15 children adopted, then that would be the 15%. Basically, but we can put that in real numbers as well. So I'm happy to share that around and say, yeah, I don't have the exact numbers. I think it's about, might be about 20 or so children adopted this year so far, but don't quote me on that. I'll have to go back and double check. But I'm happy to put in the actual numbers so we can see the difference. I've just done a presentation to Adopt East, which is the collection of local authorities in the Eastern region that work together as a regional adoption agency, and there I put in the actual difference. So I think across the whole of the 8 authorities in Adopt East, we've seen 63 less children adopted, to sort of give that sort of real picture of how many actual children that is. But hopefully that explains.
Yeah.
Yes. Can I just quickly come back, Terry? We'll get a good point. Thank you very much, Paul. That does help a lot in understanding. In other words, it begs the question, I would quite like to know where the others went. You know, if we're going to have that little group, and we need, it would be useful just to have a sort of a comment on, where the others go, so we get a picture of the general exiting from CLA.
Yeah, and we have that, so we can easily share that.
And I know some of them grow up and then go on into adult, etc. But that would give you the context. I think would be helpful. Thank you.
No problem.
Jenny?
I was just going to say very briefly there, Mark, as we've seen over a number of years, there's been an increase in special guardianship orders, which has balanced out the adoption data. which has been something that's been happening over a number of years. But obviously there's been other issues in terms of court delays about children exiting care during COVID, although we're seeing progress there. There's been a lot of good work done with the local judiciary. Thanks.
Thank you. Nigel.
Thank you, Chair. And obviously you yourself noted the worrying figures for the care leavers, EET 17 to 21-year-olds dropping. Can you, or can officers tell us exactly what's going to be done on this to monitor this?
So that's part. Oh, Joe can come in, but I'll just see if I get it right. That's part of the skills strategy, and I know that the YC Hearts team are monitoring out and working with it. I mean, this is obviously in line with. I'm assuming, obviously, it's in line with jobs. You know, they're just not there. Those early starting jobs have just disappeared, and hopefully this will all change after. When we all open up again. So, Joe.
You're right, Chair. That's exactly it. So we know that there's emerging data now on the impact of the pandemic, particularly on our young people and those aged 16 to 24. We know that they've been significantly impacted by the fact that many of the job markets they move into are simply closing down or reduced quite significantly, including, I think it's a 16% reduction in apprenticeships during this period of time. So there really is a need for us to sort of step up and get sort of operational strategic grip on that area as a consequence of the pandemic. It's right at the heart of some of our recovery planning, that skills and work agenda for young people. We're looking at how we can really build on some of the really good work that's already happening within YCH Services for Children and our broader LEP partnerships to think about engagement with employers and the job market, as well as that targeted one-to-one support and group work support for young people to really support them into work experience, skills, apprenticeships, thinking about how we build on the Kickstart scheme and what that looks like across Hertfordshire. So there's a lot of good work that we're planning to step up as we move forward in the context of pandemic. It is worth noting, specifically with in relation to care leavers, while we are seeing our NEET figures going in the wrong direction, we also have seen record numbers of children who've been in care moving into university places. Some really good figures there, and indeed our A-level results in the summer for young people in care was particularly good. So there's lots of good work happening, but there is a concern and a challenge about making sure that young people, as they leave school, and particularly our more vulnerable cohorts, so young people who've been in care, young people with SEND, those engaged with the youth justice system, those are the cohorts where we're seeing the data beginning to go in the wrong direction. We need to really make sure we're stepping up some opportunities for them as we move forward.
Yeah, so Nigel, we've got it in hand. It's just about getting it started again. So
okay,
you know,
we'll keep an eye on that.
We're keeping an eye on it, and I say as the economy opens up, I suspect that quite a lot of that will be alleviated, and we have our advisors within the YC Hearts team where they're going to help direct young people, and also there's the Hertfordshire Opportunities portal where jobs etc. are being advertised. So I think there's quite a lot being done, but it's just making sure that young people know where to go. So absolutely. Okay. Right, so I think we've done that one, haven't we? So again, we're being asked, the panel is asked to scrutinise current performance and comment on any areas for improvement and or of interest. So I think we've done that. So colleagues, could I ask you to approve the report? Good. Right. Thank you very much, Paul. That's all gone through lovely. Thank you very much indeed.
You all soon.
Bye-bye. So we're on to item 7 on the agenda. which is recommissioning of overnight short break services for children and young people with SEND. And we've got presenting for us Julie Reddish, who is Senior Commissioning Manager. Julie, are you there?
Morning.
Hello.
Morning. I'm sorry, I think my internet's slightly slow, so I do apologise for that.
That's all right. We've got Marion as well.
Hello, Marion.
Good. So, have you got a? No, you're talking us through this, aren't you?
Yes, I'm going to talk you through this. I just really wanted to give you a brief overview of the report, what I've submitted, and really would like to just update the panel on the overnight short breaks consultation that took place during the spring of 2020. I'd also like to update the panel on the revised timeline for the recommissioning of the overnight short break service, and to build in a emergency bed provision when we do go out to tender for this service. So just to sort of give you a brief background again to the overnight short breaks service that currently runs in Hertfordshire. As you probably no doubt know, there's 3 services. We've got the Pines in Hertford that is run by Action for Children, and they run out of a Hertfordshire County Council building. We have West Hyde in Rickmansworth, which is also run by Action for Children, and again out of a Hertfordshire County Council building. And we also have then Jubilee House Trust, which run Pear Tree in Welwyn Garden City, and they run out of their own building. All of the services are either good or outstanding with respect to Ofsted. So why do we need to go out to recommission? Well, the reason we need to go to recommission is that we need to meet our procurement regulations, which we haven't retendered this service for a number of years. And we also need to ensure that we have an updated service specification. We have tried to re-tender this service over the last few years, and more recently this was postponed due to COVID. So really we need to now look at recommissioning. Last year, just as COVID was happening, so it was February when it went live, we went out to consultation, so that ran during the spring, and we collected feedback from a number of families that obviously undertook the consultation. We also, over the last couple of years, have run more targeted questionnaires. So we feel that over the last sort of couple of years, we've collected a great amount of feedback from our families in Hertfordshire regarding overnight short break services. So just to give you some of the key comments and findings from this, I just wanted to sort of outline what has worked well. So feedback is that they feel that there's a great quality of care that is being provided currently within our services, and there was comments on the quality of staff and the support that was provided. There was also feedback on the quality of time that families felt from an overnight short break. This enabled them to have time with other members of their family, and it struck a sort of a carer-life balance. From the feedback that we've collected, what doesn't work so well, there was families have reported that regarding capacity, that they would like more consecutive stays, and they also felt that the communication lines between providers and parents needed to be improved. We asked families what they thought of the times and the dates available to them, and 71% of those felt that they were satisfied with the times offered and the dates that were offered to them. We asked what could be provided to make a real difference for children and young people and their families. And again, things like more nights, consecutive nights, than being able to buy nights was important. They felt there needed to be more around the crossover to day and night. They also felt there was more need for things like home sitting, babysitting type services, and they felt that there was need for the children to be in an environment that was familiar to them. They like that their children could interact with similar age groups as well. So going forward, we are proposing to retender the service, keeping the three settings settings across Hertfordshire that I mentioned, going out to tender for that after the elections in June. We are currently working at the moment on a service specification and closely working with Hertfordshire parent carers, carers in Herts, and a number of professionals, including health. As part of that revised service specification, we're also looking at the opportunity to include an emergency bed. Trends over the last few years have shown that there's a dramatic increase for requests, and this has sometimes been at the cost of overnight short breaks. So what we're wanting to do is build in a need for an emergency short bed, which will fall outside of having impact on the overnight short break service. So it will be in addition. The proposed timeline is for the tender, as I say, to go live in June, and we will evaluate an award during the period September to November. This will allow then a period of service mobilisation in December through to March, so we can allow for a 2P and obviously on Ofsted registration, with a new service commencing in April 2022. With respect to the tender, as I mentioned, we'll look at the 3 lots, and we're starting to undertake market engagement currently. So that's sort of my brief run through my paper, but I wanted to know if anyone had got any questions.
Okay, thanks Julie. So I've got Mark, then Nigel.
My goodness me, what a different paper this is from the one that last came to this panel. Was it 4 years ago? Andy Lawrence, aged 20 years in that last, when you had to do the massively unpopular move to move people away from Nascot Lawn. And it's so good to see a positive air, and just the feedback is now, yes, it needs tuning. It's got to be tuned. That's absolutely right. I welcome the idea of home babysitting. Seems to me an absolutely natural thing to do. Take the resource to the family if possible, if the resources can allow. I remember the discussions about consecutive stays. The problem is actually matching the children and the availability. It's all very well in theory, but you don't want to put a 4-year-old and a 15-year-old in the same group, because they just don't have any, there's nothing there for them to relate to each other. So I understand that it's an absolutely desired outcome, but I wouldn't hold you to account if you couldn't quite match it. It's just something you should look hard to do. And the other thing, of course, was going back to the previous study, the amount of concern there was about the health support their children would get. I mean, it was and understandable. I mean, this is no criticism. Families were frightened. They were absolutely frightened their children were going to suffer if they moved into the new provision. So to see that now being more a question of adjustment, there's some negative comments, but it's nothing like the scale that we had. In the time I've been involved with children's services, that has been the biggest issue I've ever had to get involved with. I'd say without concern. Okay. Emergency bed, absolutely got to be right. You've got to have somewhere where children can go to, if anything that may, if you can accommodate the demand and have emergency beds, that's great. But I think it's essential. There should be somewhere they can go to. The only question I have left after all that is, as far as the lots are concerned, at the moment, as I recall, you have 2 providers. One does 2 and one does 1. Are you looking to get a single provider for all 3? I know you described it as 3 lots. Or would you be content to have 3 different providers? I mean, I remember when you did the original division, one of the great issues you had to, and you've overcome it, was to make sure that the service being delivered was consistent and fair to every child, whichever provision they went to, and that hadn't been historically the case. I mean, forgetting Nascot Lawn, which was a unique thing in itself anyway. So, sorry, a bit of a speech, but I'm just delighted to see that we've now moved into a much calmer, more mature state of delivery, and I'd be interested to get your feedback on how you actually intend to see it happening.
So, Julie, I'm not sure if you are able to respond to Mark's question because of the procurement regs, but anyway.
Yes, I can. The intention is to go out to tender with the 3 lots. That gives us the opportunity to attract perhaps a smaller provider because they could actually go for the 1 lot. However, having said that, what we're wanting to also do is benefit from economies of scale and efficiencies if we can. So we will be looking to see if providers do bid for more than 1 lot, what potential efficiencies could actually come as a result of that. So, for example, we would only have 1 head office, or we'd only have 1 HR department. So that could actually be more attractive with the tender we receive. But at this moment in time, it's looking at how we can ensure that that service specification is delivered to the highest quality, and obviously bearing in mind efficiencies as well. We will assess that as part of the evaluation for the tender. So I suppose the answer to that is we're going in with an open mind. I'm just pulling together the evaluation panel, which will involve Carers in Hearts and HPCI as part of that evaluation, as well as various other professionals. So it will be decided at tender evaluation rather than going in with an open mind. Having said that, I do think there's some advantages for perhaps 2 of the areas within Hertfordshire. So, for example, a central Hertfordshire location, and perhaps the Pines setting, which is currently in Hertford, having some greater workings together simply through geographical spread. The building that we own, which is West Hyde, which is over to the west of the county, is very west, and I'm not sure what benefits of the same provider will be for that with regards to working together with the geographics. So we will see what comes through with tender. One of the other things I wanted to just add to what Mark said was we are looking for innovation as well with this tender. So there'll be some questions asked around how providers will be able to provide that sitting service that I mentioned, and also looking at how the consecutive nights or bookings could be looked at being managed by providers. So we'll be looking at building that into the tender as well.
Okay, thanks, Julie. Nice and full. Thank you for your comments, Mark. I think officers have worked terrifically hard over the last, is it 4 years? I suppose it is really, yeah, nearly 4 years after with the problems that we did have with the decommissioning, as it were, of Nascot Lawn. And I think all of our local authority officers rose to the challenge beautifully. And I know it was a hard time for families, and I acknowledge that. But we did our best all the way through. That's a royal our best. But I was very, when we were looking at this recommissioning, I was very concerned that we had to make sure that every parent who could possibly use this service had an opportunity to have their say, because I didn't want this recommissioning to be of concern to parents. As far as I'm concerned, it should only make it better. So if anybody's talking to anybody, please do reassure them that this is not to make life more difficult. We're wanting to make things better. So that's what we were in very much a listening phase for the last nearly 2 years. So Nigel.
Thank you, Chair. And yeah, Mark's taken a couple of things I was going to say. Certainly on the consecutive nights, I was going to ask Julie, you know, what plans have we got to facilitate more consecutive nights? I understand the point about the age gap and stuff, but so, all right, if she takes that on board, I still just wanted to ask on that. And then interesting what she mentioned about West Hyde, and then she's talking about the geographical difference, the fact that West Hyde is a long way down here on the west, So are we ruling out then, I'm assuming, the administration ruling out that we won't have 4 sites, we're only going to stick to these 3 sites and that's it? Because obviously the whole issue in the past was that we thought we were going to have 4 sites, but if we're just going to have the 3 sites, if there's some idea that West Hyde is almost going to be, I'm not saying cut off, but it's not going to be the same as the other 2, there might be some concern there. So I'd just like to hear a bit more on that. And on this panel, you've got the HPCI. I mean, who else is going to be on that panel then?
Okay, so Marion, do you want to come back about the strategic number? Because I think it's important to address that.
And the funding.
So we are going to stick with 3. It would be a significant investment taken out of services in the community if we were to open a 4th. And what we're trying to promote is that seamless follow through into adults in terms of connected lives. So what we are trying to do wherever possible is connect children within their community, give them the opportunity for a whole range of short breaks within their community, rather than investing more resource in overnight short breaks, which, however nice it is still an institutional setting and is something that is paid for, is arranged by the council. So it's not the way that we want to go. And it's also not the way that families overall have wanted us to go. They like the opportunity of personal assistance, other services within the community, direct payments, which they can choose how they spend, how they access support for their children. So it would be that choice, and we don't feel, and families overall don't feel, that that is a choice that we would want to make.
Okay, thanks, Marion. Julie, do you want to answer the rest?
Yes, I just wanted to sort of stress that although I mentioned that West Hyde sat towards the west of the county, I wasn't implying that they wouldn't be running the same service specification. That's one thing I want to make clear, is that we will be going out to tender with the same service specification county-wide. So whether you'll be running the service at the Pines in the east or West Hyde in the west, it will be the same expectations of service for our families, and we'll be monitoring that to those levels, and we'll be setting KPIs to the same across the county. I think secondly, with regards to who will be on the panel, we will also be including professionals from social care, and we're just working out who that will be. And also we'll be asking for representation from health, as well as colleagues who work in our brokerage team, because obviously they place our children into our overnight short breaks settings. So we need to make sure that we're including those people as well. So I'm just wanting to have a wide breadth of people on the panel that work with our children and our families at certain points in an overnight short break situation. And then you mentioned also sort of age and consecutive nights. Children that will be referred to an overnight short break come through our social care process. So they will be automatically referred through that process. And that's where our brokerage colleagues come into this. Families will be allocated a number of nights per year, and what we will be asking as part of the new service specification is providers to work with families and how they use the nights that they are allocated. So it will be in a relationship that will be between the provider and the family. Obviously we will be monitoring that. So there does need to be quite a lot of family choice in when they can use those nights, and what we're asking providers to do is work with families in the new service specification to plan those 3 months at least in advance.
3 months.
Which then gives the provider the opportunity to get the appropriate staffing in for those nights, and obviously they can work out the mix of children that will be in there. There is talk with the providers, and this will be part of the tender, of them developing an online booking system even, so families will be able to put their requests in, like almost like a hotel booking system. But it will be interesting to see what the tender brings, because this is actually quite exciting for our providers, because they're wanting to actually develop themselves. So that's why this is quite a good opportunity to see how the families how the providers are actually jumping to our requests, as well as saying, how can you give more choice to families when they're booking nights? And this is some of the innovation that they're talking about. So this is what we're hoping to actually get from this tender exercise. And we'll have to see. So, but that would be really exciting if families could actually go online and be able to say, over the next 3 months, I'd like this night and this night. Obviously, then it would have to be properly managed by the provider to ensure that the appropriate staff and children mix is suitable, but it's a step in the right direction.
Okay, thanks, Julie. Is that all right, Nigel?
Yeah, I was going to say, so in theory then, from what Julie's saying, there could be, if you maybe go online, families may have more choice for more consecutive dates, we hope.
Potentially, yeah.
Properly, but that's what we need to look at.
That's fingers crossed. I have to say, this is all subject to what comes through the tender, that's how we're writing the tender, is to look at innovative, I knew I'd have to say that word today, yeah. Ideas.
So I suppose what we probably have to make sure is that everybody gets their fair share, and that's going to be the issue for officers. They're going to have to work that one out.
It's a tender. Yeah. Thank you.
Okay, all right, thank you very much. So there are no more hands. Can't see any more hands going up. So we come to this is proper voting now, because the recommendation is the panel is asked to note and comment upon the report and recommend to Cabinet that Cabinet approves the update of the consultation that took place during the spring of 2020, the revised timeline for the recommissioning of the overnight short break service, and the Director of Children's Services' intention to build into the overnight short break service specification emergency bed provision to be funded as on a pay-as-you-go basis outside the main overnight short breaks contract budget allocation. So colleagues, with this, we're actually taking this to Cabinet because I wanted to ensure there is complete visibility what we are doing to our families out there. So could I ask you to vote, please? Okay, so I think that was unanimous. Yeah, all agreed. Thank you very much indeed. Thank you, everybody. So there's no other business, and colleagues, we've come to the end of our last meeting in this term. Can I say thank you to all of you for your support over these last 4 years. I think it's been a terrific panel. We've got through so much work. It's actually been tremendous, and I'm really grateful to you all for that, and it's made my life a lot easier that we've all been able to work quite closely together. Can I also thank all the officers for their professionalism? I think we have some terrific presentations, and I'm blown away by how professional our officers are, and I can talk say that from a regional and national perspective. We are really, really lucky to have the officers we have in children, young people and families. So again, officers, thank you very much indeed. Can I just say, he's not here, but Andy Manson actually retires shortly, actually. And I want to just record in our minutes, Andy is head of service for YC Hearts. Can I record how very grateful I am to Andy for all the work he's done over the years for the authority, and he will be missed, especially on his work around NEAT and young people's skills, because that's his forte. So please could somebody take that back to Andy? He might be listening, I don't know. So thank you, Andy. Colleagues, I wish you all the best.
Teresa, before you finish, can I actually thank you as our chairman? I mean, it's been a pleasure. I don't say very much at these meetings, but the learning, it's an experience which I will always be thankful for, of course. And also, Jenny, it's lovely seeing you on the screen here. But thank you very, very much to all the team. They're actually professional, and there's a lot of jealousy in some of the other boroughs, which I have a relationship with. And I can tell you, we are superb. We stand head and shoulders above a lot of organisations. So congratulations, and I wish you well, whatever will happen next term. I wish you all very, very well. And Teresa, once again, thanks a million for everything.
Okay, thank you very much, Alan. I was just going to thank everybody and wish everybody who's standing again good luck. And for those people that aren't standing, good health and long life for you all. It's terrific to stand up and become a councillor, and so I'm really, really grateful for that. I was hoping to have the last word, but Mark.
Yeah, well, I was sorry, Terry. I was going to say, as your official opponent, as it's a sort of strange world we're in here, I just wanted to repeat a lot of what you said. Clearly, out there, and when we get out of the hustings, we'll be shouting the odds. But I wanted to say I think you've done a great job chairing. I absolutely agree with you about the team that are working on behalf of our children in the county. They are superb. And thank goodness they are, because they've had to face some massive challenges. So thank you, Jenny, and your team. And we've enjoyed keeping you to the mark, Terry. I hope we feel we've tried to be positive in our comments and not go for the hostile simply to be hostile. But at the end of the day, it's all about the children. And I've enjoyed working in this panel. And who knows, if I'm back next year, I will enjoy doing it again. But that's out of my call. But thank you for what you've done.
Thank you very much, Mark. Yes, I think we all work in that one area where actually it's the young person that matters, no matter what the politics. So we always try and do our best. Saying that, look at that, just before lunch, as usual. Thank you very much, everybody. Good luck to you all, and I hope you all the best for the future. Thanks very much.
Thanks very much. Thank you.
Yeah, bye-bye.
Thank you, Terry.
Thank you, everyone.
Thank
you, Terry.
Take care. Wish you all the best.
Thanks, Sue. Thank you.
Take care. Bye.
Bye-bye.